Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. Today's topic is what you need to know about lumbar sympathetic blocks. A lumbar sympathetic block is a procedure used to relieve pain in the lower extremities from several neurologic and vascular conditions. The sympathetic nerves come off of the spine and they regulate a lot of activities behind the scenes in your body, such as activating sweat glands, dilating blood vessels, fight or flight phenomenon, such as when you're faced with a scary situation. And this is called the autonomic nervous system. All right, so look here. This is from the front. This is your iliac crest, so that's L4-5 area. Your sacrum's down here. This up here in the middle of the lumbar region is where the sympathetic nervous systems are. The nerves, okay? Who does well with a lumbar sympathetic block? Well, there's a number of conditions that can benefit. First and foremost is RSD or CRPS, that's reflex sympathetic dystrophy or complex regional pain syndrome. Those who are experiencing phantom limb pain after an amputation, post-herpetic neuralgia, shingles, cancer or pelvic pain, and non-operative peripheral vascular disease. Here's an example of what you see with RSD or CRPS that has gone on and on. See how this extremity is swollen and inflamed looking and really painful. This person probably can't even wear a sock because it's probably so painful. The procedure is performed by having the patient lay on his or her stomach on an x-ray compatible table. Usually IV sedation is given. You can go, the pain doctor can go unilateral or on both sides if necessary with the needle. Fluoroscopy is used, which is a real-time x-ray machine for guidance. Once the needle is placed down along the sympathetic chain area, some dye is injected to make sure that they're happy with placement and not inside a blood vessel. And once acceptable placement is achieved, then numbing medicine along with some steroid is placed. The pain doctor may also use phenol, which is a type of alcohol for longer-term pain relief, or a radiofrequency ablation to try and give the longest relief possible. Here's an example of what's happening here. You can see the needle coming in. This is the spine. This is the spinal cord. And then around the front here, this is where the lumbar sympathetic nerves are. So it could just be one side, or they could go ahead and do both, depending on the patient's condition. Are there risks? Yes, there are small risks of infection, nerve injury, bleeding, anesthesia, allergy. These are less than 1%. There's also a chance of a drop lung or some temporary numbness, also pretty uncommon. Usually right away, patients will notice an increased temperature in the leg and the veins feel full. This is normal, and it means that the block was positioned correctly. A temperature increase of about 2 degrees Celsius denotes a successful block. What are the outcomes? Sympathetic blocks have been shown to be an excellent pain-relieving procedure for those suffering from RSD and CRPS. Oral opiates often do not help with the type of conditions that we're talking about. Phantom limb pain, RSD. You may have to take very high doses, which can cause addiction, tolerance, constipation. So a sympathetic block can be an excellent way to get pain relief without opiates. Nevada Pain offers the top pain management in the Las Vegas metro area. They have several locations accepting over 50 insurances. They provide both medication management and interventional procedures such as sympathetic blocks. Call today at 702-323-0553 and visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the network. Your pain stops here.